Hi Physios, now we are going to see the effects of high heels on lower extremity biomechanics and balance in females. A systematic review shows that greater plantar flexion throughout the gait cycle due to the increased heel height. When high heel shoes are worn, the increased ankle plantar flexion brings the ground reaction force vector close to the center of ankle and increases the vertical impact loading in gait. So this increased load can be reduced by adaptive changes in kinematics of proximal joint or through direct absorption of soft tissues. So this lead to increased load on ligaments and muscles surrounding the joints of lower limbs, which may trigger tendonitis of muscle tendon unit, the inflammation of bursa, or progressive stretching of ligaments around the joint. So reduced ankle ROM because of high-heeled gait due to continuous plantar flexion, which weakens the effect of triceps surae on ankle joint and causes a reduction in propulsion of ankle. And also, body is exposed to greater impact forces earlier and the dynamic loading on the musculoskeletal system is increased in high-heeled gait. The increased plantar flexion of ankle leads to reduced pronation during support with high-heeled shoes, and part of the shock absorbing function of pronation may be lost, resulting in greater peak vertical ground reaction force. The peak pressure, maximum force, and contact area are significantly higher in the forefoot than in the midfoot and rear foot when walking in high-heeled shoes. So this shifts the plantar pressure to the forefoot, possibly due to the elevation of heel, causes a distinct anterior displacement of COG of the body and reduces the cushioning effect of arch. The altered plantar pressure distribution may trigger arch deformation and Achilles tendon shortening, leads to discomfort and pain in the foot and development of pathology such as metatarsalgia and plantar fasciitis. So, increased pressure exerted on the forefoot when walking with high-heeled shoes have a dramatic effect on foot morphology, causing hallux valgus, varus deformity of the toe and flattening foot, and also it alter muscle activation patterns. And wearing high-heel shoes is generally accepted to cause an imbalance in the intensity and timing of muscle activity around knee joint, as well as faster and greater synergistic contraction of muscles around ankle. So the general increased muscle activity increases muscle energy expenditure accompanied by increased muscle fatigue. So which also induce a reduction in functional mobility during prolonged walking in high-heeled shoes. So COG in response to postural perturbation is constrained, thereby increasing the risk of ankle sprain or falls. And changes in plantar somatosensory and proprioceptive afferents due to the greater plantar flexion position of ankle are thought to be one of the main factors that contribute to changes in center of pressure sway. Furthermore, the decrease in postural control is accompanied by an increased risk of falls, and accelerated muscle fatigue is another factor that may affect postural control when walking in high-heeled shoes.